When people hear the word caffeine, they will usually associate the word caffeine with coffee, since coffee does contain a lot of caffeine in it. However, the Alcohol and Drug Foundation, also known as the FDA, has also seen caffeine contained in chocolate and nuts in tropical areas of the world. Also, according to the FDA, 80% of the population consume caffeine in large amounts. Today, I will talk about caffeine in a chemical perspective, the effects it has on the human body, and the recommended daily consumption, along with the toxicity levels that are with it. Let's take a look at caffeine in a chemical perspective. Caffeine is water and fat soluble, meaning that caffeine will pass through a cell's membrane quite easily. In addition, caffeine has similar structures as adenosine, and adenosine is a neurotransmitter produced in the body that promotes sleep. So when someone consumes caffeine in large amounts, it will overpower the effects of adenosine. And since adenosine binds to the receptors of the brain in the human body, caffeine will overpower that, and it will do the opposite effect of adenosine, which is not to make you tired, but to make you energetic. With this perspective of caffeine, let's take a look at the effects it has on the body. The number one effect that caffeine has on the body is increased activity and alertness. With the increased alertness and activity, caffeine does speed up processes within the human body system. For instance, the pituitary gland in the body regulates all the hormones that are produced in the body. So with the increased activity that caffeine has, it will speed up the process, and it will make someone feel a bit jittery, which is the little tingly sensation that people would usually feel. The second effect that caffeine has on the body is anxiety. And when people think of anxiety, they usually think of it as a bad thing. Depending on the person, depending if they've been through a traumatic experience, caffeine will have that effect on you if you have consumed caffeine in large amounts. So the jittery sensation that I was talking about, if you're feeling all tingly, it could resemble an event that you had from before. It could trigger some type of memories, and it should be carefully monitored how much caffeine you do consume in a day, especially within a long period of time. The third effect that caffeine has on the body is dehydration. Caffeine is a diuretic, meaning that it will make the body secrete water and salts within the body. So it is crucial that someone is careful and they should monitor how much caffeine they consume, because in a couple hours after caffeine is consumed, people will experience the effect of going to the restroom quite quickly, and it is important to be careful of that, because if the body does undergo constant dehydration, then symptoms that can occur, such as ulcers or fatigue or insomnia. And although there are negative effects on the body with caffeine, the amount of caffeine that you consume determines the effects it has on the body. For instance, the recommended daily consumption, according to the FDA, is 400 milligrams, also can be seen as 4 cups of coffee in a day. But an average American individual does consume around 1.5 cups of coffee, which is 150 milligrams of coffee, which isn't that bad. But there can be toxicity levels. It can be rare. The toxicity level, according to the FDA, is 1,200 milligrams, which is equivalent to around 12 cups of coffee. And symptoms can include excruciating abdominal pain, nausea, heart palpitations, and also insomnia and fatigue. So, as I said earlier, the amount of caffeine you consume should really be monitored. So, although toxicity is seen, it is rare that caffeine is going to reach that level of toxicity, because like what I said earlier, caffeine is water and fat soluble, meaning it will go through your body like that. And it is a diuretic, meaning it's going to come out of your system quite quickly. So it's kind of rare to see caffeine toxicity within the body. Today, I have talked about caffeine in a chemical perspective. I talked about the perspective of caffeine in terms of the effects it has on the body. And I also talked about the recommended daily consumption according to the FDA, along with the toxicity levels that can be seen. And although I have planned this whole speech under the influence of caffeine, caffeine does have its negatives and its effects, and its positive effects, and all of that. Thank you.